Hello everyone, this is a video about the herb Cistus incanus. Just before jumping into the video, if you wouldn't mind taking a quick second to either like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, as per usual, nothing that I'm saying in my video should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So someone posted a question on one of my other videos about whether basically what my thoughts are around the herb Cistus incanus. Cistus is an herb that has been talked about for quite a number of years now, and with respect to its potential utility for the treatment or co-management of folks dealing with persistent borreliosis, aka chronic Lyme disease, or potentially other chronic infections. It's usually, in my experience, usually talked about within the context of Lyme/Borrelia itself, but there's oftentimes spillover with agents that are anti-Lyme/anti-Borrelia and other co-infections or co-infections of Lyme. So with respect to Cistus, I haven't had a treasure trove's worth of experience with it. I've had maybe 2-3 dozen patients who have been working with Cistus over time. I've prescribed it to some patients. Some patients have come in taking it already. And I honestly haven't really seen a whole lot of change with Cistus. It's something where I haven't really seen it move the needle a whole heck of a lot. Now, there are potential reasons behind that. One is that Cistus, according to some of my mentors who have talked about Cistus before, talk about it having primarily biofilm disrupting properties to it. Now, evidently, it does have antimicrobial properties as well, but it evidently has more of a role to play in biofilm disruption. And so if a patient isn't ready for biofilm disruption, or perhaps Cistus isn't a very strong biofilm disruptor, maybe folks who are taking it for, say, 2, 3, 4, 5, 6 weeks don't see a difference. Maybe it's because the biofilms that they're going up against are too tenacious or whatnot, and so the Cistus just hasn't had a chance to work. Another possible reason why the Cistus hasn't really made much of a difference in my experience could be based on where the Cistus is being sourced from. One of my mentors, medical doctor from Washington State, originally from Germany, Dr. Dietrich Klinghardt. He has been talking about Lyme and co-infection since before it was more in vogue, shall we say. To my understanding, he's been treating it ever since it was first discovered in Lyme, Connecticut, once upon a time. I mean, of course, it was discovered, and then I believe to my understanding, he started treating it shortly afterwards. So I think he's been treating Lyme for like well over 30 years, if memory serves. So, wealth of experience, really, really brilliant doc, very cutting edge in terms of, exploring new and upcoming therapies, kind of fresh out of the gate. He's innovated a lot of things, so he's really brilliant doc. Can't say enough good things about him in terms of, what he's contributed to the medical community, especially in the those of us who focus on treating complex chronic illnesses in practice. So Dr. Klinghardt started talking about Cistus, oh my gosh, I don't know how long ago now, maybe 8 or so years ago, maybe, and he was talking about how it's really important. And I'm paraphrasing here, and I certainly don't speak for Dr. Klinghardt. This is just my understanding from what I've learned from the material that I've been exposed to that he's taught over the years. But my understanding is that the Cistus that is sourced from certain regions of the world is much more effective than Cistus from other regions of the world. So to my understanding, the best Cistus in the world comes from this place called Sardinia. I don't exactly remember where it is. I think maybe somewhere in the Mediterranean. I don't remember any Sardinians who are listening. I apologize for not knowing where your country is located, but geography was not my strong suit in school. Much better at sciences and maths and all that fun, nerdy stuff. But so it may be that if what Dr. Klinghardt is saying is hitting the nail on the head, it may be that some of the Cistus preparations that my patients were working with were just not coming from the right spot, and maybe it was just an ineffective form. So I don't know. But my personal experience through my clinical practice with Cistus is that I just haven't really seen it move the needle a whole heck of a lot. To be honest, I haven't really pursued Cistus beyond the experience that I've had with it, because I feel like the agents that I have in my tool bag, the various herbs and IVs and other therapeutics that I work with my patients who need antimicrobial support, seem to work really well. The biofilm disrupting options that I have access to seem to work really well. So I haven't really been overly motivated to pursue Cistus. So that is my experience with it. If anybody listening has had firsthand or secondhand or thirdhand experience with Cistus, has any opinions about it, or wants to share any experience about that you feel comfortable sharing on a social media platform, be very interested to hear about your experience. I always keep my ear to the ground about what things folks say are working for them, what things aren't working for them, what things flare them up, et cetera, et cetera. So it's always valuable to hear about what other folks have seen. And by golly, if I get a torrent of comments saying like, you fool, Cistus works so well and this and that, I'll certainly ask for some clarifying information. Where are you getting it from? Are you a Sardinian? Again, sorry in advance for not knowing where your country is, and finding more information. But always curious to hear what other folks, what kind of experience you've had. So I hope that this answered the question. If anybody has any questions or comments on this topic, please post in the comment section below. And if you have any questions about anything else, post in the comment section below, and I'll do my best to answer as soon as I can.